Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will have the opportunity to meet Dr. Lydia Laboccetta, a new urologist who just recently moved to the area. We will also meet two new providers in the area, nurse practitioner Ginny Czimber and physician assistant Bonnie Hood. Finally, we will chat with Amy Myers and Cindy Cheatham about Glitz, Glamour, and Glow, a Novant Health Foundation Brunswick Medical Center event exclusively for women. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest is Dr. Lydia Laboccetta, a new urologist in the area. Welcome to the show today, Dr. Laboccetta. It's so nice to have you.
Thanks. So nice to be here.
Great. Now, I know you're new to the area. How long have you been here?
Well, we just moved here when I finished my residency. We literally moved here like the day after I finished.
The day after.
But it feels more like a homecoming than anything else because I'm 10th generation North Carolinian and I love it here. My grandmother grew up in Wilmington and we've spent every summer that I can remember here. So my husband and I met actually in Wilmington and we've been working our whole marriage to get back here. So our dreams are coming true.
Oh, that's wonderful. Great story. Great story. So where did you relocate from?
I was doing my training down in Charleston at the Medical University of South Carolina, and Charleston is amazing.
Oh,
I mean, I was so
beautiful.
So lucky to get to train there, but we're really glad to come home.
I'm sure you are, and it's a great place to live. People are wonderful, and the weather and the water.
The water is the big draw, I think, for us.
Oh,
the clear water and just it's amazing.
Yeah, that's great. Well, tell me a little bit about your education. You said you went to MUSC.
Yeah.
And that's where you did your residency. Where did you go to undergraduate school?
I actually did my undergraduate degree at Wake Forest in theater. So that was
in theater
a while back. And then I did my medical school training at Eastern Virginia Medical School in Norfolk. So we've been on the coast for the whole thing. So, yeah.
And so your specialty is urology.
Yes. Yeah.
And tell me a little bit about that. How you got into urology and.
Well, I think that somehow in medicine people just kind of figure it out. I would never. When I first started thinking about going into medicine, I would never have thought that I would be a urologist because, frankly, I didn't know what that was, But I initially thought I wanted to do primary care because I really like patients. And then as I was kind of coming through, I was so drawn to the surgical aspect of things. And I think that urology is just this amazing relationship with patients where it's similar to primary care in that you have patients that you see for their vasectomy and then their kidney stone and then their prostate cancer, and you have this continuity of care, but you still have that surgical background that I enjoy so much. So, and it's this really intimate relationship.
I bet it is.
We talk about things that are so delicate. People tell me things every day that they've never told anybody else, and I think that's just such an amazing trust, and just I love my job.
It builds a strong relationship, and it's obvious that you love your job.
Yeah, I've had a lot of
You're
jobs.
Very passionate.
And I like this one the best.
Well, let's talk about urology a little bit in terms of what organs would be involved, because some of our viewers may not know actually what a urologist does. So let's start with what organ systems you might.
So initially, anything dealing with urine. So the kidneys, the tubes that drain the kidneys into the bladder are the ureters, and then the bladder, and then the prostate kind of sits at the base of the bladder. The urethra is what you pee through, and then the penis and the vagina. And these are things that I talk about all day long. So really anything that can happen to any of those things is something that I would treat. So, you know, we see a lot of stones. This is the stone belt. We see cancers originating from any of those organs. And also something that a lot of people don't consider is the adrenal glands, which are a little organ that sits on top of both kidneys. And I had a lot of experience treating adrenal masses and nodules and things like that in my training. So.
Now, you touched on surgery and that you really like to do surgical procedures. And I understand you'll be doing many of those at Brunswick Medical Center. So let's talk a little bit about the procedures that you might do there.
Sure. You know, I think that the thing that most people know a lot about nowadays is robotic surgery.
Oh,
it's very well marketed, and and it's really fun.
Is it really fun?
It is. It's, you know, you don't want to tell patients that it's like a video game, but it's like a video game. It's just, it's this really cool application of technology that is definitely changing the way that we practice, because some of the most invasive procedures that we used to do are the pelvic floor surgeries. The pelvis is like a bowl, and when we're operating down in that bowl, you really have to get a lot of what we call exposure. So people had to be kind of open from stem to stern to get down there. And the biggest advance in robotic surgery is the wrist action that we have that allows us to just kind of tunnel down into this bowl and do very, very fine surgeries. So it's something that it's one of the reasons I'm kind of glad that I was a little bit later coming into medicine, because honestly, if I had trained 10 years ago, I wouldn't have had the same exposure to it. So
yeah, it does seem to be the thing of the future, and it's here now, but
yeah, at our tiny little hospital, we have a Da Vinci robot
that's so amazing to have it in Brunswick County. I'm so excited about that.
I know.
Not that I want to have it, but I'm glad we have that option.
It's a great resource, and it's such a bragging point. And you know, we do every other minimally invasive technology. We treat kidney stones with tiny little telescopes that go all the way up to the kidneys, and we can put little laser fibers up there and blow up the stones. My father-in-law actually suffers with kidney stones, and he's told me stories about how he had to have open surgeries for his kidney stones 30 years ago. And nowadays there's no reason for anyone to suffer with a stone. I mean, I can treat it and street it. You know.
And that's the lithotripsy?
Well, there's a lithotripsy from the outside that's using ultrasound technology. And that breaks up the stone, hopefully into parts that are small enough to pass. But some stones just
won't break.
They don't respond to that treatment. We have to be able to see it on an X-ray for one thing, and some stones you can't see with an X-ray, and then and some stones just don't fragment very well, so we end up having to go up and chase them down. But yeah, we have all that at our disposal here. So.
Wow, I know that. Some folks suffer from incontinence. I would think that would be a big thing. Can you talk a little bit about incontinence and what causes that, and some of the treatments for that?
Definitely. That was actually an interesting part of my training down in Charleston. I worked with Dr. Eric Rovner, who is literally a world leader in incontinence. Believe it or not, there is actually an International Incontinence Society. So, and he's a member of that. And, you know, one of the things that was just kind of drilled into me in my training was that the most important thing about incontinence is understanding where it's coming from. So, you know, leaking isn't leaking. Some people leak when they cough or sneeze. Some people have what we call turnkey incontinence, where they are getting home and they're like, oh, I'm not going to make it to the bathroom. And just understanding the differences between and among the different types of incontinence helps to direct our treatment. And unfortunately, I saw a lot of women, especially in my training, who had been treated with surgical therapies for more of a medical incontinence and had kind of been drug along for a while. So, I mean, I think the most important thing is to open the dialogue with someone who understands that it is a complex issue and that can kind of help you tease out what exactly you have wrong with you before we start talking about treating it.
Well, I know I've learned so much today, and there's so many other topics we could talk about, but we just don't have the time today. I'd love for you to come back so we could look at some of these other areas. So let's talk about your practice. The name of your practice is?
Novant Health Urology Partners.
And you're located?
We're right next to the hospital.
Right next to the hospital in the new medical office building there.
Exactly.
And how might patients make an appointment to see you?
They should call our scheduler extraordinaire, Jill. The number at the office is 721-4150, and she should be able to get you set up.
Do patients need a referral, or can they self-referral?
We have a lot of self-referrals. We get lots of referrals from the ER. And I think it's always very important to have a primary care physician who's your head coach. But that shouldn't prevent patients from coming to see me.
Okay, great. Well, it's been a pleasure having you here. I look forward to seeing you very soon.
Thanks. So nice being here.
Our next guests are Bonnie Hood and Ginny Czimber. Well, welcome to the show, guys. Ginny, Bonnie, it's such a pleasure to have you guys here today.
Thanks for having us.
Yes.
And I would like to begin today by just getting to know you a little better and letting our viewers know about yourselves and what you do. So let's start with you, Ginny.
Okay.
And I understand that you already lived here. Is that correct?
That's correct. I've lived in Brunswick County for about 8 years.
Wow. Do you love it here in Brunswick County?
I do love it in Brunswick
County.
County.
We all
no
do.
snow.
I know. It's great. And tell me about your education and your background.
Okay. I got both my bachelor's and master's degrees in nursing at Stony Brook University in New York. Once I completed my education, I went to work at an endocrinology office in Wilmington and left there earlier this summer and moved over to Oceanside.
Oceanside Family Medicine and Convenient Care in Charlotte. Great. Likewise, Bonnie, I think you're new to the area, though, right? You moved here from somewhere.
Yes. And I love it here.
How long have you been here now?
Less than 2 months.
Wow, you're still a newbie, huh?
Yes.
Yeah, it's great. And you're also at Oceanside Family Medicine.
I am.
In what capacity are you there, Bonnie?
I am a physician assistant, and I work in the convenient care clinic.
Great. That's a great clinic, and it's such a great thing for the county, for Charlotte, to have that available to them. Ginny, getting back to you, what is your primary focus at Oceanside Family Medicine?
My primary focus is diabetes management. I spent the last 6 years, as I said, working in an endocrinology office, and so there was a definite need in Brunswick County for somebody with my skill set, and so I agreed to come down and help Oceanside Family Medicine and Novant in general to better manage their patients who are out of control with diabetes.
And how did, and this question is to both of you, what made you decide to sign on at Oceanside Family Medicine and Convenient Care? What about that practice interested you?
It offers me the opportunity to combine the two things I enjoy doing the most, acute care and diabetes. I'm also a certified diabetes educator, and I look forward to working with Ginny, maybe doing some classes for the community.
Yeah, so you guys have that commonality there.
Yes, Bonnie is going to be a wonderful asset for me. I have a lot of experience managing diabetes, but I am not a certified diabetes educator, and so her knowledge will complement my practice perfectly.
Oh, that's great.
Yeah.
And were you familiar with Oceanside Family Medicine prior to?
I have lots of neighbors who are seen as primary care patients at Oceanside Family Medicine. And so they came very highly recommended to me.
Wonderful.
And once I had been to the clinic and met all the providers, I knew that I would fit in pretty well, and it would be a place that I would really enjoy working.
We actually did a show a while back at Oceanside Family Medicine and Convenient Care and took a tour and showed the whole office. It is a beautiful office.
It is.
It's a great place. Dr. Eisenhower has a wonderful setup there. So you briefly touched on the other providers. Let's talk about some of those and remind our viewers who else practices at Oceanside.
Okay. Well, there's Dr. Clark Pritz, Dr. Angela Thompson, and Dr. Eisenhower.
Marie Whitley is a nurse practitioner. John Fillmore is a nurse practitioner.
That's right.
And Tiffany Lewis is a PA.
And now the addition of the two of you.
That's
really
correct.
growing down
It
there.
is. It's
quite a few
growing
people.
quickly.
Yes.
Yeah. Well, some of our viewers out there may not know exactly what a family practice is, and that is what that is. It's a family practice. So let's talk a little bit about that. Maybe tell our viewers what constitutes a family practice. Do you want to answer that, Bonnie?
Sure. Taking care of the entire family.
The entire family.
Yeah.
That's pretty simple.
From birth to death.
Oh, yeah. Well, that's good. Then you don't have to go to all these different places. You can just stay at one practice and have it all taken care of. And you can bring grandma with you. And then, oh, by the way, my granddaughter has a cold or whatever.
And often it's the same provider who provides care for all the members of the same family.
Really nice.
And so they know the family history, they know what's going on, and, you know, socially and emotionally. And
Right. And sometimes that's as important as that actual symptom that they're exhibiting.
Absolutely.
That's great. I think you guys are going to be really happy there. I'm so happy that
I think so too.
that you've joined on there. Let's talk about some of the services and procedures offered at Oceanside. Now, you work in the convenient care side, and how is that open every day?
It is. We are there 7 days a week. Weekdays, we are there from 8 a.m. to 8 p.m. Saturday from 9 until 6, and Sundays from 1 until 5. And it's a walk-in clinic, or people may call and make a same-day appointment.
Good information. Now, I assume there are some minor procedures done in the office. Can either of you elaborate on that?
I'll let you do that one. More of them.
We do.
Do you remove fish hooks? Because that's important here.
Yes, absolutely. And
Some of us.
quite a bit of suturing.
Oh, no. That's from all those oyster shells, right?
Yes.
Especially this time of year, right?
Yeah.
Yes, and remove some skin lesions,
Oh, okay.
ingrown toenails.
Okay.
Yeah.
So quite a few things, really, that wouldn't necessarily require a referral to a specialist or surgeon.
Or an
anything.
emergency room.
Do either of you have any special interests? Now, I know that yours is diabetes. That is your special interest or your particular focus. How about you, Bonnie? Other than the diabetes education, do you have any other special focuses or?
Well, the acute care.
Yeah. And do you also do like women's services?
We do. Yes, we do. Well, women exams.
Right. Yes. Well, that's good. You've kind of got a one-stop shop there.
We do. We also have lots of radiology services. Ultrasound,
Really?
Ultrasound, X-ray on site.
How about lab?
We have our own
Yes.
lab. You know, they're sent out, you know, to be
Right.
cultured or read or processed. But we have our own lab techs in the office.
So
all
you
day
do all
long.
the blood draws right there.
Yep.
And you can do ultrasounds and x-rays.
X-rays.
That's also very good to know. So that if somebody walks into convenient care and they've got like maybe something might be broken, they've got x-ray right there. Wonderful, wonderful. Well, it's been a pleasure having you two on today. I look forward to bringing you back at a later date when you've gotten some time under your belt and see if we can delve further into the diabetes portion of it. Because I think in this area, that's a real important topic.
So do I.
So.
Yeah. But thanks for having us.
Yes, thank you very
It's been a pleasure. I
much.
look forward to seeing you very soon.
Okay.
Our last guest for for the day are Amy Myers and Cindy Cheatham, committee members for Glitz, Glamour, and Glow. Well, welcome to the show today, Amy and Cindy. It's such a pleasure to have you both here today. Now, I know we're going to talk about something called Glitz, Glamour, and Glow, and I am so excited to hear about this. But first, I know, Amy, you've been on our show a couple of times before, so let's reintroduce you to our viewers. So tell us a little bit about yourself and what you do at Brunswick Medical Center.
Sure, I would love to. My name's Amy Myers. I've been with the hospital about 7 years now, and I wear a few different hats, but today, primarily here, talking about our foundation. And I serve as Executive Director of the Novant Health Foundation, Brunswick Medical Center, and I also work with our marketing and community outreach efforts at the hospital. So I'm very lucky to have a fun and exciting job where I get to work out in the community and really get to know people.
Sounds like fun. Yeah. And Cindy, I know this is a side job for you, so tell us what your real role is in our community.
Yes, thank you. I am an outreach provider representative with Lower Cape Fear Hospice and Life Care Center, and I primarily am just in the Brunswick County area. Our home office is in Wilmington. Prior to this, I was in the fundraising part of Lower Cape Fear Hospice, but have really enjoyed doing what I'm doing now. I've been with Lower Cape Fear Hospice for 5 years.
Wow, that's a great organization.
Yes, it is.
Yeah. Now, I know we're going to talk about Glitz, Glamour, and Glow. We're going to talk about the foundation a little bit, Amy. So how about giving us an idea about what's the purpose of the foundation at Brunswick Medical Center?
Sure. We were incorporated in January of 2011. So we've been going a couple years now, and basically the foundation is a separate 501c3 entity with the purpose of helping to raise funds to help improve healthcare in our community. And really what I tell people is that we look to go beyond the walls of the hospital. So the projects and the efforts that we work on are things that outreach further into our community than what we can do just right there at the hospital. So we've had a couple projects going, our women's and children's wellness outreach, and we also this year have built a patio at the hospital, a healing and respite patio. So we're really excited about the progress that the foundation has made in a pretty short time.
Yeah, it's a relatively new organization, and you've done a lot of good already in the community. So that's a great start there. So let's talk about Glitz, Glamour, and Glow, because I'm all about that. Now, I hear this is exclusively for women. So, Cindy, tell me a little bit about the event.
Well, it's going to take place on Saturday, November the 2nd, from 1 to 4. It is going to be a lot of, mostly women. It'd be a great day to have, mothers and daughters and friends in the community, wine tasting and shopping and fashion and just all kinds of fun things like that really cater to a lot of things that we as women like to do.
And who are some of your sponsors?
Summit Plastic Surgery and Dermatology has been so generous in coming on as our presenting sponsor.
Wow,
so we're thrilled to have them. And they're also going to be at the event that day doing some really fun things for guests that are there and sharing information about their services and what they offer to the community. So really, really excited to have Summit Plastic Surgery and Dermatology on board.
Well, that sounds like a lot of fun, and I'm excited about Summit being there. That's great. I'm happy they're sponsoring that for you. Now, I know you mentioned there'll be shopping, so let's talk a little bit about what kind of shopping and what can we expect to see there, Cindy?
Well, I can talk about a couple as Island Breeze will be there, as well as Victoria's Rag Patch, and you can name some of the other ones that are going to be there.
The Tulip Tree, which is fairly new in Ocean Isle. She's going to be there. Shop Girl from, I think they have locations in Southport and one on the southern end of the county as well. And that's
Lucy's.
And Lucy's from Holden Beach. And we've got a few others as well. So a really good mix of what I would say are some of, our finer boutiques in the area. So I think the nice part, we're a big county, really spread out. So when you do go shopping, you just go to Southport or you just go to the southern end. So we hope we've brought kind of a sampling of some of the really great vendors in our community to one location And being that it's just a short time before the holidays, being on November 2nd, I think, people will certainly probably do a little Christmas shopping, but also hopefully some shopping for themselves too. They're like me, that's usually how my holiday shopping works. One for me.
I did that too.
Bobble for you and a bobble for me.
Right.
Yes, I like that. I like that equation. Well, I know we talked about wine, so let's talk a little bit about the kinds of wines we can expect to see, and what about food?
Yeah. We're working with a wine distributor out of Wilmington, and so they'll be able to we'll have about 6 different wines, kind of more, I guess, boutique type wines, things that you wouldn't necessarily find in the grocery store, something fun and different to try. House of Wine and Cheese in Leland is also helping us with the event, so we'll kind of have those 6 different wines so people will be able to shop and stop and taste wine, and then our food is kind of hors d'oeuvres meant to go along with the wines.
So it's kind of appetizers. Will there be like a dessert wine and a dessert? Ooh, that sounds great.
Yes, I think we're hoping to do some pairings and that kind of thing, which I think will be really neat.
Yeah, that is really neat. Well, let's talk about tickets. How much does it cost to get in?
It's $50, but for VIP it's $75.
And tell me about a VIP ticket. That sounds like something I might like.
Well, I'll touch on some things. Something that I like is that you get a swag bag.
Yeah.
So that'll be fun. There's some little extras there, and you can expound on some of
the swag bag, and then a signature wine glass for the event. So
that's
just
cool.
our VIPs will get that, something kind of special memento to take home. And then a lot of our Summit Plastic Surgery and Dermatology, as well as some of our other sponsors and the fashion partners, are also doing some special things for our VIPs. So there'll be some extra benefits kind of provided
so it's
to those.
Just buy the
folks.
ticket and come and see.
Yeah.
It's got all these surprises. Yeah. Well, that sounds great. Now, you said the tickets are $50 each and $75 for the VIP ticket.
Yes.
And will those tickets be purchased at the door, or do they buy them ahead of time?
We certainly
Both?
encourage people to buy them ahead so that we'll have a good idea of a count and know people how many to expect. Yep, absolutely. And to make sure your spot gets reserved, because we are finding that it's going to be pretty popular, we think. So we ask for people to call, and they can call us at the hospital at 910-721-1460. And from there we can work out reserving a spot. We're actually not going to do physical tickets, but we'll have a sign-up list, and people will come in and just give their name and be able to enter that way. So.
Oh, well, one last time, Cindy, let's go over the logistics. It is Saturday, November 2nd. Is that correct?
Yes.
And the time is?
1 to 4.
1 to 4.
At 101 Stone Chimney Place. So it's right in the center of the county.
And that's also known as the Realtors Building?
Yes, it is.
So that's easy to find there in Supply. It's a great location. It's a beautiful venue.
It is.
It's very, very nice. Well, that sounds like a lot of fun. I can't wait. Is there anything else you can think of that our viewers need to know about the event that we haven't touched on? Maybe I've not asked all the questions I could.
I can't think of anything. I would just say get your tickets early. I do think it's going to be a popular event. I think because it's pre-holiday, it'll be it's before all the stresses of running around happen. So it'll be a fun time.
Well, it just sounds like a fun time
it
for
will
me.
be.
And get together, maybe a group of girlfriends.
Yes.
Or, I think that'd be a great time.
Instead of a girls' night out, it'll be a girls' day in.
That's right.
That's right.
And thank you so much for that information about the foundation. I think that's a great cause, and the funds again will be used toward the women's and children's services.
I'm glad you brought that up. That was going to be the one thing I wanted to mention that I don't know that we touched on, is that for this event, funds will go specifically to our women's and children's wellness outreach. So we really, have talked about this event as, we said primarily women. I think it really is women helping other women in our community.
And that's very, very important.
And that wellness component kind of centers around childhood obesity, smoking cessation for pregnant women in particular, and lactation for new moms. So some really...
And we haven't had that in this area before, so that's really, really important.
Yeah.
And the obesity in children, I think that's we really need to concentrate on that.
So a lot of fun for a good cause.
That's right. Well, thanks again for being here, guys. It's such a pleasure, and I look forward to having you back and learning how it went.
Thank you.
Okay.
All right.
Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Please visit novanthealth.org for more information on Novant Health Brunswick Medical Center, local physicians, and general health information. Thank you again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.